Well, hi and welcome. My name is Hedva Levy. I am a clinical pharmacist. I specialize in working with older adults. I'm a geriatric specialist, and I'm going to talk today about know your medications, steps towards safer medication use. So here in St. Louis, just a little bit about my background. I have a clinical practice where I work with older adults in their homes. I help people, I review medication regimens with older adults and their family members and help them identify and correct medication-related problems in working with their healthcare team. I also teach at the College of Pharmacy here in St. Louis, and one of the topics I teach on is Parkinson's disease. And the last piece about me is that I've been a volunteer with the APDA here in of Missouri for many, many years with working with their support groups, their various support groups. So it's great to be here to share some of my information about medications that are commonly used to manage Parkinson's disease. So 4 goals I've set out for today are here. The first is to talk about the medications used to manage the motor and some certain non-motor symptoms of Parkinson's disease. I'll talk briefly about the dietary supplements because I know I get a lot of questions whenever I speak to groups about Parkinson's disease, where those supplements might fit in. And then I'll talk about some non-drug interventions and various good management strategies for Parkinson's disease, and then wrap up by talking about general safe medication topics as we age and steps that you can take to use all of your medications more safely. So to jump in, I'm going to be talking about these 7 different classes of drug therapy that we use to manage the motor symptoms of Parkinson's disease. So I'll be breaking it down into the 7 categories. I wanted to highlight that the levodopa carbidopa, which is the brand name of that, the main one we think about is Sinemet, although there are some others, and the dopamine agonists. These 2 main drug classes are the mainstay of therapy. And at some point, I would expect everyone to be on the levodopa carbidopa or a dopamine agonist, sometimes in combination. And definitely the levodopa carbidopa is our gold standard. But I'll talk about all these categories one by one, give you a general overview. So the first drug class, the most important one, is the carbidopa levodopa. As I mentioned, Sinemet is the most commonly known brand name of it, but there are some others. And this slide is not meant to overwhelm. It's just to let you know that there are different formulations that this medication comes as, the carbidopa levodopa. There's an immediate release formulation, there's a controlled release formulation, and then the Rytary is even an extended release formulation, which is a combination essentially of an immediate release and a longer release product. There is a enteral suspension, which is used for later in the disease process when it gets more challenging to manage the motor symptoms. So that's another option. And there is even a combination with entacapone. We'll talk about what this COMT inhibitor adds, but carbidopa levodopa can even come in combination with that 3rd drug. So lots of different formulations and ways to dose and get the carbidopa levodopa medication. Place in therapy, as I mentioned, it's the gold standard. So eventually everyone will be on carbidopa levodopa at some point. Sometimes we start with it, sometimes we switch to it later. It has several side effects, as do all of these medications: nausea, dizziness. The orthostatic hypotension is where when you stand quickly, you might experience dizziness due to low blood pressure initially. So medications can contribute to that, but also the Parkinson's disease itself is associated with that orthostatic hypotension. So it's something we have to balance when we use the medications. Drug interactions, the one I like to make sure people know about is that iron can interact with carbidopa levodopa and decrease the absorption of the medicine, making it less effective. So it's important just to be aware that you're not taking a vitamin that contains iron and not realizing that there's an iron product. Ideally, you want to take this medicine on an empty stomach, but it can cause nausea. So then you need to take it with some food. Generally, it's not a problem to take it with food initially. Be aware that another important interaction is with dietary protein. So at some point, for many people, I should say, we need to consider the protein interaction with carbidopa levodopa. But again, some people, it's not an issue initially, but it's something we might think about later on. The next really important medication group that we often use with to manage the Parkinson motor symptoms is the dopamine agonist. So there's 3 different medications available for this option: the pramipexole, ropinirole, and the rotigotine, which comes as a patch. These two, the apomorphine has a little unique place in therapy. I'll talk about that a little bit later on. But these medications are great alternatives to levodopa, carbidopa. Not quite as potent, but very, very good medications. Some of the side effects are listed here on the right side of this slide. And so we have to be aware of that. Swelling of the ankles can be a problem for some people. The hallucinations, sleep, more vivid dreams is somewhat common. And the other thing we worry about is the impulse control disorders. So for some patients who maybe are predisposed to an impulse disorder, we see maybe increased tendencies for gambling. Maybe somebody might go on a shopping spree, but things like that. It's a very interesting side effect, but it's something we do have to be aware of and identify early should it become a problem. The dopamine agonists have a benefit in that there's a lower risk of dyskinesia. We do worry about something called dyskinesia, which is the uncontrolled movements of the head and neck, upper body that can happen with carbidopa, levodopa when we get too much dopamine. So that's again a dyskinesia term you'll become familiar with. And we think about the medications and whether they contribute to dyskinesia or not, and dopamine has a little lower risk. The next group is the MAO-B inhibitors, and these medications are solid drugs that we can use for the motor symptoms of Parkinson's disease. Typically, if we use them on their own, it's going to be at the earlier stages of Parkinson's when the symptoms are more mild, because these drugs have only a modest effect on the motor symptoms, in contrast to the levodopa, carbidopa, or dopamine agonists that we just talked about. There's 3 drug choices in this medication class. The selegiline and razagiline can be used on their own or added to other Parkinson's medications. The sulfinamide is a little bit different, Xadago, in that it has to be used only added on to carbidopa, levodopa, as I've noted at the bottom of this slide. So it would not be used on its own. The other thing that's very notable about the MAO-B inhibitors, if those are ever prescribed for you, is the drug interactions. So there's some very notable and potentially serious medication interactions with the MAO-B inhibitor. So if you ever are taking one of these drugs, it's important to know about the potential for interactions and what those drugs might be, and to always ask before adding a new medication to your therapy. And that's where this slide comes in. So this is taken from a great resource that the APDA has available that talks about specifically the interactions with the MAO-B inhibitors. So on this slide, I would just mention that some of these medications are available without a prescription. So it's really important to be aware of those medications. So for example, St. John's wort is a supplement that you can get without a prescription, and that can have a very important interaction with the MAO-B inhibitors. You would not want to combine it with an MAO-B inhibitor. And then the cough suppressant dextromethorphan, that's the DM that you might see in some of the cough and cold medications on the market. So again, be very cautious and avoid those products with dextromethorphan, the specific cough suppressant. And the decongestants, called pseudoephedrine, phenylephrine, and ephedrine. These are available without a prescription. So the Sudafed or Sudafed PE, these types of products, you would want to avoid if you're taking an MAO-B inhibitor. The other medications are by prescription, but it's important that you, as a patient, that you be aware of the potential for interaction so that you can help your whole healthcare team be alert for and look for interactions so you can avoid any concerns. The next drug class is really just one medication. It's amantadine. And this is a medication we don't quite know how it works towards Parkinson's disease, but it somehow enhances the dopamine release, a dopamine effect in the body. What's unique about amantadine, it's been around for decades. It originally was used as an antiviral medication, which is kind of interesting, but it has the benefit for Parkinson's disease. The side effects are listed, some of the more common ones on the right side here. But most important with amantadine to know is that if you have reduced kidney function, the dose might need to be lower. So that's always something to be aware of. Amantadine is not the most potent medication for Parkinson's. It has more modest effect on motor symptoms. It's maybe more effective for younger patients and earlier in the disease process. But as I mentioned, it's been around for decades. More recently, we've noted that it has a benefit in treating dyskinesia. So 2 new products have been approved in maybe the last 5 years or so, and that's Gocovri and the Osmolex ER. So these specific products have been approved for treating dyskinesia, which again is that involuntary motor movement that can happen with after several years of carbidopa-levodopa use. And so one way to manage the dyskinesias is to adjust your medications to lower that dopamine peak, but also adding amantadine is another tool in our little toolbox to help maximize the control of your symptoms and minimize the side effects, if that makes sense. So amantadine is another option, but it has a more specific focused role, if you will. The next drug class is the anticholinergic medications. We don't see these a lot in older adults, people 65 years and older, because of side effects with these medications. So the anticholinergic medications include trihexyphenidyl and benztropine, or Cogentin is the brand name of that one. In older adults, we worry about problematic side effects. So not only is it dry mouth and dry eyes, constipation, urinary retention, but we worry a lot about the memory impairment and confusion. So those mental status changes that are more likely as we get older in older adults. So with anticholinergic medications, they're not a great choice for individuals who are 65 years or older. If you're younger and you have tremor as your main side effect, or I'm sorry, your main symptom, an anticholinergic medication has a reasonable role for you. As we get older, though, we probably want to avoid using these anticholinergic products. The next group I want to talk about is the COMT inhibitors, and COMT is an abbreviation for the enzyme, the mechanism of how it works in the body. So COMT is an enzyme in the body that breaks down levodopa throughout the body. So when we take carbidopa-levodopa, it's important that once it's absorbed from the stomach into the bloodstream, it has to cross into the brain to be effective. And the COMT inhibitor prevents the breakdown of levodopa in the body, throughout the body before it gets into the brain. So it helps increase the effectiveness of levodopa. So this is a medication that's only added on to a person taking carbidopa-levodopa. As I mentioned the very first slide at the beginning, carbidopa-levodopa comes in combination with one of these COMT inhibitors, entacapone. So that just helps with the pill burden. It's one pill instead of taking a separate pill. But where do the COMT inhibitors fall in our management of Parkinson's symptoms? It is an add-on therapy to the levodopa-carbidopa, and most commonly, if a person is experiencing what we call wearing off of the wearing off effect, when your symptoms return before the next dose of carbidopa-levodopa is due, that's a sign that the drug is wearing off, and we can extend the effectiveness of carbidopa-levodopa by adding a COMT inhibitor to the drug therapy. So it has a great role for maybe as the disease progresses, so middle to later stages, where you need extended motor control to get you to your next dose of carbidopa-levodopa. Trying to think what else to emphasize. You never want to use it alone. Like I mentioned, it only is of benefit in someone taking the levodopa, as it will extend the effectiveness of levodopa. So in Stalevo, in the middle of the slide here, is that product that is entacapone, a COMT inhibitor, combined with carbidopa levodopa. And I think that's about it on these medications. So again, a very special role in adding on to carbidopa levodopa therapy. And the last of the 7 classes I'm going to talk about is the selective adenosine A2A receptor antagonist. And that's a mouthful. So you think of, I guess, adenosine receptor antagonist is a shorter way of referring to it, but it's simply the mechanism of how the drug works in the body. This drug was approved in the last couple years only, so it's fairly new. There's only one drug in the class, istradefylline or Norians. And this is a medication that is, again, never would be used on its own. It's only going to be added on to someone taking carbidopa levodopa when there are more off episodes. And off episodes refer to the decreased effectiveness of carbidopa levodopa, where the motor symptoms return. Maybe the slowness is there, maybe there's more stiffness, muscle rigidity. And if that happens throughout the day, there might be a role for adding Norians, which would help reduce those off episodes. So it's never to be used on its own, only added on to other therapy. Of note, I note on this, I put on the slide here that istradefylline doesn't have a direct dopamine activity. So when dyskinesias are a concern, and dyskinesias typically are related to that too much dopamine being in the brain, Norians doesn't necessarily add to that dopamine boost, if you will. So it has maybe again, a unique role that can be used for helping to maximize the benefit of the medications and reducing side effects of them. So again, one of the newest drugs we have available. So this takes us back to a recap of just looking at those 7 classes that are in our toolbox for managing the motor symptoms of Parkinson's disease. Levodopa, carbidopa, and the dopamine agonists are the most potent, strongest medications we have. So those are the mainstays of our that we go to. MAOB inhibitors are less potent, but they have a role certainly in extending the benefit of carbidopa levodopa. Amantadine has that unique role in helping with the dyskinesias. The anticholinergic agents, we want to really not use them in older adults, people 65 and older, but for younger patients or where tremor is the main symptom, they have a role. The COMT inhibitors are only added on to levodopa carbidopa to help extend the benefit of levodopa carbidopa. And then that last group, that adenosine receptor antagonist, again, would only be added on to someone taking levodopa carbidopa as well. And I think that's it. I don't want to overwhelm you, but and the one comment I have when I talk about medications for managing Parkinson's motor symptoms for patients is that there's a lot of hope. As I mentioned, there were several new medications that have been approved in the last couple of years. And so there's a lot of research in this area. And I think we're seeing a lot of hope in having better drugs to choose from and better combinations to use. And that's a good segue into this next slide, where I just wanted to highlight some of the drug therapy we have that, again, is fairly new, but that's available for this for rescue therapy, if you will, or on demand when the off episodes occur. And I mentioned before, the off episodes are when your motor symptoms return, where you feel more stiffness, more muscle rigidity. So a kind of the diminished effect of the Parkinson medications can occur as the disease progresses. So we need drugs that can help address those off periods, and things that work quickly are ideal. So that's where this slide comes in. So the 2 apomorphine products are dopamine agonists. And remember that dopamine agonist is one of the drug classes we have to use, we use to manage motor symptoms. But the apomorphine is special because it's injectable, or you have to take it by an injection under the skin or sublingual film. So it's not a tablet that you can take as those other medications. It's very short acting, and it works quickly. So when you need that on-demand therapy, some kind of quick relief of the to get the motor control improved, an apomorphine product that's where it fits in, if you will. And the other option we have is an inhaled levodopa product. So Inbrija is, again, fairly new. It's an oral inhalation medication that contains levodopa. So you can only use this product, the Inbrija, if you are already taking the carbidopa levodopa product, Cinemet, on a regular basis. Trying to think what else is important here. So just other tools in the toolbox for that off episodes, and those can be very troublesome, right? So it's nice to have newer options to help manage those situations. The next piece that's really important, I like to emphasize when we talk about understanding the medications and how they help your Parkinson's motor symptoms, it's important to know what medications to use with caution. And I always want the patients and the caregivers to be familiar with this information, because I want you to feel that you're part of the healthcare team. Some healthcare professionals may not be aware of all of the medications we have to use with caution. So it's important to know what questions to ask to make sure that your healthcare team is looking at all of the drug therapy and avoiding drugs that can worsen or negatively impact Parkinson's disease or the medications you're taking. So on the first bullet point here, drugs that interact with the MAO-B inhibitors are really important that we avoid them or use them with caution. I mentioned those earlier. So if you're taking an MAO-B inhibitor, one, I want you to know that you are taking a drug with that action that works in that way, and therefore to be aware of those medications. And so, like I mentioned, APDA has a great handout that highlights all that. The other really important piece is for anyone who has Parkinson's disease, certain medications can worsen Parkinson motor symptoms, no matter what medications you're taking. So these are medications that can can further deplete the dopamine in your body. And the Parkinson's is caused by a dopamine depletion state. So any other medications that can further kind of take away the dopamine activity will worsen Parkinson's symptoms. So it's important to be aware that some medications we want to avoid totally for anybody with Parkinson's disease. And those here would be main ones to think about. Medications that are used to treat nausea, you need to be very cautious. Reglan is a drug that has been around for a long time. It's used for nausea. It's been used sometimes historically for reflux symptoms, but that's a medication can worsen Parkinson's disease because it decreases the dopamine. Compazine and Phenergan are other medications for nausea that we want to, that again deplete the dopamine, so we want to avoid those. And then the other group that's really important to be aware of are any antipsychotic agents, like haloperidol, olanzapine is Zyprexa, risperidone, Risperdal. Sometimes if there are behavioral issues that are associated later with a psychosis or later in the disease, we want to make sure we avoid most antipsychotics. There are a few exceptions, so I've tried to list them here so you can be aware of some drugs are okay in that drug class, and those exceptions are clozapine, quetiapine, and pimavanserin. So again, just to know that there are medications that need to be avoided if you have Parkinson's disease. And the piece here, I kind of mentioned it already. Not all healthcare professionals will know about these interactions, so it's important for you to be familiar with these types of interactions so you can be part of the conversation to make sure to have people double check. Not that you have to know every medication name, but that you can know to ask to make sure the medication does not interact. So now I'm going to switch gears a little bit and talk about non-motor symptoms of Parkinson's disease. There's many that have been identified, and as I always teach my pharmacy students, these non-motor symptoms are very, very prevalent in persons with Parkinson's disease and can almost be more problematic or equally problematic for your quality of life and for your well-being. So from this list, I'm going to talk about 3 particular non-motor symptoms because we have drug therapy that goes with them. The first is orthostatic hypotension. The second is psychosis, and the third is cognitive impairment that's associated with Parkinson's disease dementia that can occur later in the disease process. So on this slide, I highlight, don't have them in the same order, but the first row is the Parkinson's disease psychosis. So in later stages of Parkinson's disease, some patients experience what's called the psychosis. Some predominantly hallucinations are present. And I mentioned antipsychotic agents, most of them need to be avoided. Pimavanserin is a very unique drug. Nuplazid is the trade name. It is considered an antipsychotic, but it does not affect the dopamine levels as do other antipsychotics. So that, because it doesn't affect dopamine, it's the perfect agent for a patient with Parkinson's disease. So Nuplazid has the approval from the Food and Drug Administration specifically for Parkinson's disease psychosis. The other drug that is specific for Parkinson's disease symptoms, that orthostatic hypotension, droxidopa or Nerthera, was approved several years ago, but fairly new. And this is for patients if you're experiencing severe orthostatic hypotension. It's always important to try the non-drug approaches first, but when you need a medication, Nerthera has been specifically approved for this purpose. So that's another drug you might want to be aware of. And then the last one on the slide is for the Parkinson's disease dementia, and that's the drug rivastigmine or Exelon. And Exelon is a medication that has been used for Alzheimer's dementia and other dementia, but it has a specific approval by the Food and Drug Administration for Parkinson's disease patients. So important to know that these medications have a solid role for these situations. Next on my objectives for today is to talk about the dietary supplement use in Parkinson's disease. So I wanted to just back up a minute and give you an overview of dietary supplements. I want you to be aware that these medications, these supplements, I consider them medications because they do have side effects. They have pharmacological activity in the body, but they're regulated in a very different manner compared to prescription medications and even your over-the-counter medications. So dietary supplements they're treated as food by the FDA rather than medications. And I always say buyer beware regarding the safety and effectiveness of supplements. This table highlights some of the differences between prescription products and the dietary supplements. So as I mentioned, prescription and OTC products are regulated as drugs by the FDA, the Food and Drug Administration, whereas dietary supplements are regulated as food. With the drug products, they cannot be marketed without the FDA approving the product in advance and approving the safety and effectiveness and saying that, yes, the drug meets these standards. In contrast, a supplement can be put on the shelf without getting any kind of FDA approval. It's only after the drug has been on the market, the supplement has been on the market, and if there's a documentation that side effects are occurring, and this has happened many times over the course of the years, of the decades, the FDA can then seek to have that supplement removed. So it's only after it's been marketed. In contrast with the prescription drugs and OTC products, the manufacturer has to prove that the drug is safe and effective before it even goes for the FDA approval and before it gets on the shelf. And so the last piece is the manufacturing products. The prescription drugs and OTC products have strict manufacturing standards that the manufacturer has to meet. These standards are set by the FDA, and the FDA does regular checks of the manufacturing process for the medications. For the dietary supplements, the manufacturers are encouraged to follow good manufacturing practices, but there's not as strict scrutiny of the manufacturing sources. So there are some caveats with the dietary supplements. And because we don't have, the FDA does not require safety and effectiveness data on these products. We don't always have the safety, neither safety nor effectiveness data. It is growing for many products, but it's not as it's hit or miss, if you will. So just that little buyer beware background. What are some of the dietary supplements that we people think about or have asked about with Parkinson's disease? I've listed on this table, when I kind of Googled in preparation for this talk, what is some of the hot topics, or what's in the conversation for Parkinson's disease and supplements that people are interested in. So we'll talk about each of those in just a minute, but I want to just emphasize again that most supplements lack sufficient research to really know about the benefit of these supplements or not. Unfortunately, if there is a study, they're going to be very few patients, smaller studies, maybe several weeks of duration, not necessarily months or years. So we don't always have that long-term information. And remember, so that interactions is important, and adverse effects we may not know as much. Okay, so with that caution taken care of and spoken of, let me talk about some of these selected supplements. So calcium is definitely recommended for patients with Parkinson's disease. There is an association of Parkinson's disease and osteoporosis. So actually making sure you get enough calcium. Ideally, we want to get it through the diet, but because of the protein interaction with the carbidopa levodopa that I mentioned earlier, sometimes patients don't get enough calcium through their diet because dairy foods, which is a great source of calcium, are high in protein. So that might impact some of why we see more osteoporosis in Parkinson's patients, or patients with Parkinson's disease. So calcium is probably something that would be more helpful and something to think about. Coenzyme Q, a lot of people are interested in that. Over the years, I've gotten lots of questions and less interest, and then more interest. Again, depending on the decade. There's not a lot of evidence to support its benefit, though. So it's something probably is not going to be harmful, but it may not be of benefit. Creatine has been asked about. There seems to be no benefit. There are some studies that have tried have looked at creatine with no positive outcome. Ginger has been looked at and might be helpful for nausea, which is fairly common for many patients with Parkinson's disease, and sometimes worsened by some of the medications. So ginger, you can steep it, or in tea. Often people are doing that. There's certain ways to get ginger. Glutathione is something people have asked about. There's research ongoing, so jury's out, but we're waiting for more information on that. And then there's some vitamins that there's been people ask about. There's been a lot of interest in. So with vitamin C and E, these are antioxidants, may or may not be helpful. Vitamin E is associated with increased bleeding. So I do caution people about vitamin E in case someone is taking aspirin, or even some of the antidepressant medications can increase the bleeding risk, or certainly if someone is taking an anticoagulant, which is a blood thinner, if you have atrial fibrillation or other health condition where you might need an anticoagulant. So be cautious of bleeding with vitamin E. Vitamin D is helpful for bone health. So I kind of put that back up there with calcium. That's something to think about. Certainly if your vitamin D levels are low, you want to make sure you do get a vitamin D supplement. And then vitamin B, so the vitamin B like boy, B6, B12, and then folate, are possibly helpful in Parkinson's disease. Some literature shows that it can be beneficial. Certainly if your vitamin B12 levels are low, you'll want to take a B12 supplement, and that can be an oral supplement as well. There's injectable, but you can do an oral supplement of the vitamin B12. So this is just some of the more recent supplements that people are asking about, or kind of is in the news, if you will, the gray media. But I always encourage people to talk with their healthcare professional before adding a dietary supplement to make sure there's the safety. We know that, as far as we know, that it's not going to be harmful, and that it won't impact other medications you're taking for Parkinson's disease. I always, whenever I talk about medications for any health condition, including Parkinson's disease, the non-drug piece, the non-pharmacologic piece is really important. And you might think, I'm a pharmacist here, why am I talking about the non-drug stuff? But with any health condition, it's important to do what we can to help the medications be as effective as they can, if you will. And maybe we won't have to rely as much on medications at times. So for Parkinson's disease, exercise is so very important. Tai Chi and balance training have shown to be beneficial through well-done studies. And the APDA here in Missouri, the St. Louis office, has lots of support groups and Tai Chi exercise activities and things like that. Dietary considerations are really important. I mentioned the osteoporosis, low, weak bones consideration with patients who have Parkinson's disease. So calcium and vitamin D is very important. Talk with your healthcare professional about to make sure you're getting enough in your diet. Drink plenty of fluids. That's really important to help not only with constipation, which can be a non-motor symptom of Parkinson's disease, but also it can help with that low blood pressure, the orthostatic hypotension that can come, can be associated with with Parkinson's itself, but also some of the medications can make that a little bit worse. So make sure you're getting enough fluids. And then the other pieces on here, physical therapy, occupational therapy, and speech therapy are all part of what will help you manage your motor symptoms, your daily activities, and your quality of life. And again, APDA Missouri has phenomenal resources to help you through all of this. Some other considerations I just want to touch on. The timing of medications is so important. As the disease, as you move through the stages of the disease, it will be even more important that you get your dose of dopamine, be it levodopa, carbidopa, or any of the other drug classes I talked about, on time. But we're mostly talking about the levodopa, carbidopa, because that has to be dosed several times throughout the day. You need to make sure anyone caring for you is educated about the importance of the timing. If you are ever in the hospital setting or in a rehab setting, or you have a fill-in caregiver, someone else helping you out than the usual person who knows you and knows your regimen, you need to make sure they understand you have to have your medicines at a certain time. Keep a movement diary to help with medication adjustment. So when people come to me where they're struggling with movement, the off episodes or the dyskinesia, maybe they're not in good control, it's helpful to track it if you can with a diary. This will help any healthcare provider look at you and your medications and know how to adjust that drug therapy. And since we have our smartphones, so many of us have the access to maybe even do a video, which could be very helpful to sharing with your healthcare provider of what your symptoms look like in order to help understand what might be causing them. So when you keep that diary, be sure to note when you took your medication, and then relative to when you took your medication, when you're feeling those different symptoms. Be aware of drug interactions, be informed. I highlighted a bit those different medications that can interact with the MAO-B inhibitors, but also with Parkinson's disease. And always ask when a new medication is added, just to be safe. And I always say when something is stopped too, you want to make sure that there's not an interaction that is going to be affected. I talked about the non-drug strategies to improve disease management, so remember those. Communicate with your healthcare team about your symptoms. Reach out if you are not feeling right, if the medicines don't seem to be as effective as they were before. Maybe it's iron, maybe it's protein, maybe it's something else going on but we can adjust those medications. And commonly, anxiety and depression can worsen if your symptoms are not as well controlled as they should be. So don't feel like you're alone. Don't feel like you don't know what you can do, because you have a healthcare team that will help you work through the medication options and refine and revise your drug therapy regimen so that it's the best it can be for you. My last bullet point is to stay mentally and socially active, which has been shown in many studies to be helpful for just your quality of life and managing Parkinson's disease. And again, APDA Missouri has so many resources for you. So with that kind of wraps up the focus on the Parkinson's medications. I wanted to take just a few minutes to talk about general medication safety principles, if you will, with all of the medications you take. So Parkinson's disease does not happen in isolation, and you will have other health conditions going on, even if it's some of those non-motor symptoms, and drug therapy will be, you likely will be taking other drug therapy. So from all of my experience of working with older adults in their homes over the last 25 years, I have put together this book called Maybe It's Your Medications. It came out from Skyhorse Publishing in July of 2023. And I just wanted to take a few minutes to let you know that this book is available as a resource, a support tool for you to understand the questions you should be asking about your medications, but also to highlight why it's so important to be talking about our medications always. So the goal of the book, Maybe It's Your Medications, is to empower patients, caregivers, and really anyone who takes medications to be more engaged in their drug therapy. We need to be asking questions. So why is it so important when I talk about even, communicating with your healthcare team about your Parkinson's symptoms and your medications? It applies to all of us in all situations, really. So very quickly, we have what I call a perfect storm in healthcare. We have a lot of medication use, and that's the term polypharmacy. 42% of older adults take 5 or more medications. So we have a lot of medications being prescribed. We have a population that's aging every day. 10,000 older adults are turning 65. And we don't have a lot of geriatric trained healthcare professionals. So understanding how we can best manage and use the medications in older adults as we get older, we don't have a lot of expertise in that area. And the last piece is that older adults are out in the community. You guys are asked to manage your Parkinson's medications. You're asked to manage your other health conditions kind of on your own in your home. So errors can happen. I've certainly seen that over the years as I've worked with the different clients that I've had the privilege of working with in their homes to talk about their drug therapy. So the perfect storm all leads to the suboptimal medication use. And what I'm most concerned about is when medications, when they are used suboptimally, when there's different ways that can happen, but when it's not the ideal medication or not the ideal dose, for example, it can lead to adverse effects. And my goal is to help people prevent the medication-related problems, the side effects, and adverse effects. So why is it that older adults are my focus, right? I'm a geriatric specialist pharmacist. I mentioned the importance that we have healthcare professionals that have that geriatric expertise. Older adults are more vulnerable to some of the risks with suboptimal medication use. And what are the reasons? I've highlighted them here. We take a lot of medications. We have different physicians involved in our care. You'll have specialists. You have your primary doctor. And sometimes the communication is not always ideal in that situation. We also have pharmacokinetic changes and pharmacodynamic changes. These are big terms that I introduce in my book, but it really means we handle the medicines differently. We don't get rid of them from our body as easily. Our kidneys don't work as easily as well as they did when we were younger. Our liver function might change, for example. And so that makes it harder to eliminate medicines from our body. And then the pharmacodynamic piece is we're more sensitive to the effects of medications. Remember when I talked about anticholinergic, that drug class of anticholinergic medications for Parkinson's, we don't like to use them in older adults because of the side effects. That's a great example of how the pharmacodynamic changes as we get older. We're more sensitive to the effects of certain medications. And the final piece here I talk about is that older adults are not represented in clinical trials as much as younger populations are. So just as I mentioned with supplements, we don't have the data research that tells us about the safety and effectiveness of those products. Likewise, even with the prescribed medications, we may not have the representation of older adults in those studies, which means we can't always say how effective or risky a medication might be in an older individual, someone who's older than 75 years old, for example, or older than 85 years old, let alone older than 65. So with every medication, be aware that there are risks and benefits. And I've talked about the benefits, the roles of those Parkinson's medications, and also some of the risks. Everything has side effects. And this goes also with any medication for any condition you might have, high blood pressure, high cholesterol, whatever. So the FDA approves medications based on its best evaluation of the harm, the risk of harm from that medication, and the benefit we see in clinical trials. So, but be aware that a drug will not benefit every person, and the harms will vary for each person. So it really comes down to a very personal approach to what works for you, maybe what medications you're taking, and what other disease states you have can impact the choice of a medication for you. So the benefits, of course, we see the symptom improvement, preventing disease would be wonderful. And on the risk side, we need to think about interactions and the fact that just taking one more pill, how does that impact cost and your well-being, and the side effects, of course. So it's important for every individual, for you and your family members, to advocate for safe medication use, understand the risks and benefits of drug therapy. Again, Parkinson's medications, as well as for anything else you might be taking a medication for. So what are some strategies I can leave you with? One, I encourage the principle, I encourage everyone to avoid unnecessary medications. Only use drug therapy that is known to have a clinical benefit or very manageable or low side effect risks with it. So that balance that risk and benefits equation. Know that the medication is not always intended for forever. Even with the Parkinson's medications, things are going to be adjusted over as time goes on. Certainly with, again, cholesterol or diabetes or other health conditions that might happen, you change over time, your body changes over time, maybe your nutritional status changes, your ability to exercise as much or as little as you used to. Things change. So we need to relook at our medications and maybe re-prescribe them on a regular basis. But understand that reevaluating, is a medicine still needed, and do we want to continue it, should be a very normal part of prescribing. So deprescribing is the fancy term that really addresses that. Can we reduce doses or stop a medication that may no longer be needed or might be causing harm? And two other points. So one, have your medication list with you wherever you go. And of course, as I highlighted, the importance of knowing interactions that can happen with Parkinson's medications, all of your medicines matter. So have a complete list. Know that it needs to include prescription drugs, OTC drugs, and those dietary supplements I talked about, because all of them can have interactions and side effects that need to be evaluated. Make sure it's accurate, right? If you're no longer taking something, make sure it's removed from the list. If something has been added, you want to make sure it gets on the list right away. And I would recommend that you have you know why the drug is prescribed, even note it on your list, if you will. That'll help identify medicines that may no longer be needed, right? I've talked to people who've been prescribed a medication for their stomach, for example, to reduce stomach acid, like omeprazole, Prilosec, Nexium, these types of drugs, and may no longer need it after so many weeks, but yet they're continued for months and years on end because no one really stopped to think maybe we no longer need that medication. It's important to include who prescribed the medication and maybe roughly when it was started. And this will all help when it comes time to relook at, do you still need it? Why was it started? And sometimes definitely knowing who started the medication can help identify, is it possible to reduce that medication? So important to always have that medication list. And then regularly review for three major criteria, if nothing else. Always, again, make sure you know a good reason that the medication is being used, that it's actually helping a specific symptom or health condition. We want to look for any medication that is being used longer than it's needed, when a clear duration is known. And we have that for a handful of drugs. So I would mention those stomach acid blockers. Sometimes a pain medication, there'd be a limited duration of when you want to use it and things like that. And then the third criteria is you want to make sure you're not taking a duplicated medication. Sometimes I've seen patients who are taking two medicines that are really doing the same thing, and we want to avoid that when possible. So those are some basic questions that are important to ask of your medication list. With your pharmacist is a great person, with your primary doctor is another great person. So if you so these go hand in hand. If we can look for medicines that knowing why you're taking a drug, how long you should be taking it. If you have a complete medication list, that really can help facilitate reviewing for those 3 key criteria. Excuse me. And some last points I want to leave you with. Know that you are a very important person on your healthcare team. You have I would say, the obligation to be actively involved. You know you best. You know if you feel differently. Maybe it's a side effect, maybe it's your medication, maybe it's something else going on, but you need to speak up about how you feel each day, and also how you feel about taking your medications, because if you're struggling to take some of your drug therapy for whatever reason, it's important that you share that with your healthcare team. Maybe there's a different formulation or a different, less expensive medication that can be substituted. Be involved in drug therapy choices and decisions. Know that it's all about you, what matters most to you, and what you are comfortable with. So this shared decision-making is an important part of our, what I want to say, the quality improvements we're trying to get at in providing healthcare today. It's important that you are informed and part of the decision about your drug therapy and your care plan, really. And that last bullet point I have for you is to communicate and advocate. I've said that several times. Ask questions about your drug therapy. Speak up about your concerns. If we go back to the Parkinson's disease medication options, there are many drug classes that can be we can choose from. So it's important to know some of your options and talk with your healthcare team to find the right combination that works for you. So that's my bit about kind of giving you the motivation speech to encourage you to be part of your healthcare team and know enough about your medications so that you can be aware of interaction concerns, side effects, and how best to take your medications. So with that, I will bring this to a close. I hope you found it helpful and a good resource to go back to. And I will always encourage you to go back to the APDA Missouri for those. They have handouts about the medications that are great resources for you to always have with you. And with that, I will bring this to a close.